Mental health experts say maternal mental health is very common among pregnant women and nursing mothers. Deputy Director of Nurses for Obstetrics and Gynecology Department of the University of Ghana Medical Center, Dr. Vida, tells Joy News the significance of creating the awareness.
For maternal mental health, it's one of the areas that we usually observe pregnant women, and then especially in the postpartum period, that is the post-delivery period, we see a lot of pregnant women having this puerperal blues. And puerperal blues is something that usually occurs when all of a sudden you become a mother, all of a sudden you are seeing a baby which is very fragile and you are holding the baby. Some people have not held such babies before. So when they see the baby, at times it worries them. How am I going to care for this baby? And especially those who have no support at home, they don't have parental support or sibling support, and they are alone, and probably maybe their husbands are not around to support them. They go through this puerperal blues.
Representatives from the Mental Health Authority, Lydia Saki and Lorna Lati, outlined list of events organized for the Mental Health Awareness Month.
So the Mental Health Authority has adopted the month of May to create awareness. Just as we have Malaria Day, we have HIV Day, Breast Cancer Day, Mental Health Authority too has adopted the whole month of May to create awareness, because we realize that stigma is one of the main challenges when it comes to mental health. And to be able to address it, we need to educate the people on what mental health and mental illnesses are. So we are doing that the whole of May. We actually started on 28th April. So the whole of April, from 28th April to 3rd May, is maternal mental health. So we are focusing on mothers, and that is why we are here at UGMC. So that is for the first week of May. The second week, we are doing school mental health. So we've selected some schools who will visit and give education and screen the students as voluntary. The third week, we will be doing specialist outreach clinic at the Eastern region. The fourth week, we are doing workplace mental health. So we have some selected organizations. We'll visit them, we'll educate them, we'll train them, we'll screen them. Then the final week, we'll do more of churches, mosques, and then throughout the month, we are doing a whole lot of community engagement. We are doing media engagement. We are relying on you to send a message out there to the populace.
Lorna Lati gives an estimate of perinatal women who experience maternal health.
So today, talking about maternal mental health, that's why we collaborated with UGMC today to participate in our pregnancy school to educate mothers, soon-to-be mothers and new mothers on the importance of maternal mental health. Maternal mental health, in terms of prevalences and in terms of numbers, maternal mental ill health is common in about 1 to 5 to 1 to 7 out of perinatal women. These perinatal women indicate women who are currently pregnant or have just given birth, or at least 1 year within the 1 year time frame after delivering. So it's important that we pay close attention to the mental health of mothers and pregnant women around this time, because the consequences are long term. The consequences in the long term can impact bonding with babies, impacts the growth of the newborn and the new baby, and just impacts the mother's general outlook in life in the future.